Let's bring in infectious disease specialist Dr. Sumon Chakrabarti, who's joining us from Mississauga, just west of Toronto. Good to see you again this morning.
You too, Todd. Thanks.
So the mayor there putting it well, I think. You know, it's uncomfortable and it's a hassle, and also people look a little strange too, but we need to do this.
I think so. There's been a lot of discussion about this in the last coming days, and I think that when you look at this, what we really want is the safety and well-being of all of our people in the city. And I think we know that public transit is a risk factor for the acquisition of COVID-19. So I think masks in this situation is good. And I'm also happy the city will be handing out people who can't afford or can't get a mask. So this, I think, overall good idea. And now let's all do this together and move forward.
Yeah, speaking of doing it all together, it seems like, you know, the city is really hoping, Dr. Chakrabarti, for buy-in from people, because they don't plan to have any sort of strict enforcement protocol in place. In other words, they're not going to be, you know, patrolling buses and subways and streetcars and pointing out people who aren't wearing masks and fining them, that kind of thing.
That's right. And I think that's also is something that if you look at the enforcement of this, it would be very, very tough to do. But that said, look, it's a really, really strong recommendation. It's something that can help all of us. And especially as we know that indoor spaces, prolonged contact with people in close quarters is the main risk factor for COVID-19. So the masks will be helpful here.
All right, so next up will be enclosed public spaces in Toronto, also where you are in Mississauga. There are other places around Ontario that are doing this. Is this the beginning, do you think, of sort of a national strategy that we're going to see other provinces, I know Alberta as well, starting to talk about doing this kind of thing, that we will see it coast to coast eventually?
I think so. I think that this is something that is moving and happening in many different jurisdictions. I think the main thing for me that whether or not there's a mandate, I think it's important for us to normalize masks and know where especially they can be used in these indoor spaces. Nobody should be shamed for wearing one. I think that it's something that if we all do, it can be helpful. And, you know, I'm glad to see that people are using them in indoor spaces without having to have any kind of rule or enforcement put on them.
All right, what about in the U.S.? I have to make sure I ask you about that, too, because that's a big headline. And, you know, whether we like it or not, it has a huge impact just on our psychology. We read those headlines. We're so, you know, fortunate to be here in Canada where the situation is much better. But nevertheless, 50,000 new cases of the virus in a single day.
Yeah, that is mind-boggling. And, you know, what's going on down there is a clear message to us of what happens if we don't abide by the principles of social distancing and other things to help to curb this infection. I am concerned. They're our next-door neighbor, and if there's ever a point that the border opens up, which I hope is a long time from now, we could see things come into the country if they don't have their situation under control. So I'm looking at that with bated breath and very closely hoping they get this under control soon.
Dr. Chakrabarti joining us from Mississauga. Sumon, good to have you back, and thank you for taking some time on this Thursday morning.
Absolutely. Thanks for having me. Take care.